In Japan, many hybrid neurosurgeons. Neurosurgeons do the surgical clipping and as well as neurointerventional procedure.
So it's not the same as what we see here in Europe with interventional neuroradiologists?
Yes, completely different. European neuroradiologist doing interventional procedure. But in Japan, 90% of cases performed by neurosurgeons.
Mm-hmm. And what would you say for yourself are the advantages of that system?
Oh, that is, we can judge which treatment is better. But the disadvantage is we always choose the easier and safer procedure.
Right.
So if the case is very, very difficult for neurointervention, we move the patient to the neurosurgeon. In Japan, we have a brain checkup system. Mm-hmm. The certain age of patient, they have a brain MRI. Mm-hmm. So many unruptured aneurysms is found.
So it's automatically done?
No, not automatically, but many patients have a brain checkup at maybe 50 or 60 years of age. The stroke case is, I think, gradually increasing because in Japan, when I was born, cerebral hemorrhage is a major part of the stroke. But recently, we have a lot of ischemic stroke. Mm-hmm. Maybe 60 to 90% is ischemic stroke.
Do you understand why there's this increase?
That is a change of the food. In Japan, the lifestyle changed into a Western style. So when I became a neurosurgeon, maybe 35 years ago, we don't have a very few carotid disease. But recently, we have a lot of carotid disease. I personally did carotid stenting more than 1,000 cases.
Mm-hmm. Ah, really? Is there a particular new development here that you're interested in this year?
Personally, I'm doing like a cardiologist doing reopening of the chronic total occlusion. I'm treating the case internal carotid artery chronic total occlusion. I'm recognizing these cases. My colleague named Dr. Kono, he is very talented for 3D imaging. So he purchased a 3D printer, and before treating aneurysm, he make a 3D model of the aneurysm, and we try to consider the strategy for the aneurysm. Initially, we are making the shaping of the microcatheter under the just watching the angiogram. Mm-hmm. But after seeing the 3D model, we changed we changed differently to the shaping of the microcatheter. So 3D model is very attractive and effective for the treatment of cerebral aneurysm. Also, my colleague Kono is his major research point is CFD, computed fluid dynamics.
Mm-hmm. So very important. So all of this plays a role in preparing the strategy, and I imagine it also plays a role in educating your students that will follow in your footsteps.
Yeah, 3D anatomy is very educative for the student. Right. But still CFD is in the process of the development. I think CFD is still promising for the future treatment of the aneurysm.
And something we will see in the upcoming years, or is there something presented at this meeting? Or is it too early?
Not this meeting, but one case, very impressive case. I coiled the aneurysm 3 times, but all aneurysms recanalized. So CFD data showed us the inflow zone is directly to the posterior wall of the aneurysm. So we tried to change the anatomy of the aneurysm. So we deployed the stent, and we could change the anatomy of the aneurysm. So after that, the aneurysm doesn't flicker.
So very interesting. Any last words you want to say to the LINNC online audience?
Oh, Professor Morales, thank you very much to invite me to LINNC. And also LINNC Asia. That is very interesting. So please continue this fantastic meeting.